Hi everyone, it's Lisa Moeller with Orthodontic Practice US, a MedMark publication, and welcome to another edition of Doc Talk Dental. I'm very excited to be here today with orthodontist, physicist, and the inventor of Brius, Dr. Mehdi Peikar. He received a master's degree in condensed matter and quantum mechanics from the University of Illinois, then completed his PhD in biomechanics and biophysics at Johns Hopkins School of Medicine, and did a 3-year residency program in orthodontics at UCLA. I'm super excited to have him on the show today. Thank you so much for being here, Dr. Peikar, and welcome.
Thank you very much. Thank you very much for having me.
On a rainy day in Scottsdale that we never have.
Yeah, actually, maybe I brought the rain for you. You said last week was hot, but...
Oh, you're the one who brought the rain. Okay, it's good though, actually. We kind of like it once in a while because we're just like, I think we have 2 days of rain here out of the year. It's not, it's usually in the hundreds. It's hot. It's great. The desert. What are you going to do? You're from Dallas.
I live in Dallas right now, but originally I'm from Iran.
Right.
So I moved to the U.S. About 10 years ago.
Just 10 years ago.
Yeah.
Nice. So how has your life been like post-COVID and with your practice and your business?
Actually, it's great. With Brius, we're growing a lot. And maybe it's a little bit counterintuitive, but COVID helped the orthodontic industry in general. They call it Zoom effect.
Yeah.
Everybody was in front of the camera and they were seeing their smiles and they were thinking, maybe I should think about some sort of orthodontic treatment. So.
Oh my gosh, that's so true. I never thought about that.
Yeah. So, industry of orthodontics has grown since COVID.
Right. Yeah, well, that would be, thank God for Zoom in COVID. I don't know where we would have been without that.
Yeah, I mean, obviously COVID was a horrible thing that happened to the whole world, yes. But we should always be positive, think about positive things.
Right, exactly. Yeah. And so tell me more about your unique educational background and how it started you on your career path towards Brius.
Yeah, sure. So I'm originally from Iran, and I studied dentistry, and I did a residency in orthodontics in Iran, and also I was a faculty there for 1 year, and then I moved to the U.S. Mm-hmm. During my residency, if I want to tell you the original story of how Brius idea started, I had a patient who was 45 years old. He was a teacher. Mm-hmm. And he came to the clinic every week instead of every month. In orthodontic clinics, we should see them like every month.
Yeah.
But he was in a rush, and he was saying that my students who were like 13 years old, they're laughing at me because I have braces. And before having braces, they were also laughing at me because my teeth are very, very crooked. Mm-hmm. And he had to skip classes and to come to the clinic and see me, and it kind of negatively affected his job. So. And
how old was he?
He was 45 years old.
Okay.
Yeah.
So he had this problem since he was a teenager.
Yeah, like teenagers, how
kids can be cruel.
Yeah, they could be cruel.
Yeah.
So I thought about Brius. I thought, there should be a way that we treat the crowded teeth and it's not visible, and also we don't have to do any adjustments as orthodontists, and the patient doesn't need to come and see us so frequently. So I thought about Brius. I wrote a proposal. I gave it to School of Dentistry in Iran, but they rejected my proposal. They said, it's a very cool idea, it's a great idea, but it's more like science fiction. You won't be able to manufacture Brius. So I kind of said, okay.
Which you're not the type of guy that wants to hear that for sure.
No.
Given your educational background.
No. So I did not give up on that. I was thinking about it, but maybe it was kind of true. In Iran, it's really difficult to bring a new technology. There are lots of difficulties there. But I moved to the U.S., and the reason I came to the U.S., I love physics. Mm-hmm. I love quantum mechanics. I love condensed matter. So I started my PhD in quantum mechanics and condensed matter at University of Illinois. And again, I was thinking about Brius during this time. I transferred to Johns Hopkins to complete my PhD in biomechanics. Mm-hmm. And then back then, I started to work on BS very seriously. I went to UCLA to do a second round of residency in orthodontics. And the reason for that is, I was already an orthodontist, but in order to practice in the US, I had to get a degree and like a certificate in the US. So
Right.
I did a residency at UCLA, and I was working on BRIAS very seriously. So we made the first prototype for it, and we did a lot of regulatory. There's a lot of paperwork that needs to be done.
I'm sure, yeah.
Yeah, and we had IRB for it, and then we could test it on a patient. But again, I was an orthodontist, but I didn't have a license to try it myself, so I had to convince an orthodontist to take the responsibility to use it on a patient. So the way we did it, we had a wax model of teeth, and the wax model is cold. When you put it in hot water and a brace is attached to it, it becomes soft, and then the teeth move. So we made a video, and in that video shows that very crooked teeth, the model of teeth, gets fixed with just one brace. But if you want to align those model of teeth with traditional braces, you have to take it out of hot water. You have to adjust it, put it back. You have to do it like 20 to 25 times. But we did it with one brace. So we made that video and showed it to an orthodontist, and orthodontist was kind of very impressed with it, and we could convince the orthodontist to use it on the first patient. And
It's amazing. I watched your video on your website, and it looks like an amazing product. I mean, because there's so many people that don't want to see their braces on the outside, and I love the fact that it aligns everything from the inside. Now, how comfortable is this for the patient?
Actually, it's pretty comfortable. If you compare it with traditional braces, I don't know if you have had traditional braces.
I had Invisalign.
Oh, you had Invisalign.
I did.
Okay. Okay, so compared to traditional braces, it irritates the cheeks and the lips for a few days or 1 week, 2 weeks, and after that the patient gets used to it. For brace, because it's inside and behind the teeth, it's gonna irritate the tongue for a week or so, and then the patient gets used to it. But if you compare the pain for teeth, definitely it's less painful. Whenever you go adjust your braces, the teeth are going to be sensitive for a few days.
Right.
You have experienced aligners, so
those are not always comfy either.
Exactly. So whenever you change your aligner, it's gonna be moving your teeth, and your
Right.
teeth again are going to be sensitive for a few days. So, and you have to change your aligners based on the prescription of your doctor every week or every 10 days or every 2 weeks. So you're going to have pain every 10 days or every 2 weeks. But with Brias, you just put it there. You have a little bit sensitivity of teeth at the beginning of the treatment, but the pain for the teeth goes away. So in terms of pain, it's less painful compared to after the adjustment period is passed.
Right.
But like we were very lucky. The first patient that we tried on the first patient, I would say that was a pretty simple case, a little bit spacing on the lower jaw and upper jaw. And with aligners, probably would have taken 6 months, 7 months, something like that. If the patient would have worn the aligners all the time.
Yeah, which of course doesn't always happen.
Actually, that's true. One of the big problems that we have with aligner therapy is that the patients are not compliant. 75% of the market is teenagers, and teenagers are
good luck.
not. Yes, exactly.
Good luck with that.
Exactly. Good luck with dealing with teenagers. You tell them to do something, and they don't really listen to you. Even for adults, some adults, they're not compliant with wearing aligners. You have to wear your aligners 22 hours out of 24 hours to have a successful treatment.
I remember. And then afterwards, actually, to maintain.
Retainers.
And that is the part I didn't know, is that you have to keep wearing those after the fact so that it doesn't go back.
That's true.
They don't move.
That's true. Actually, the way I talk to the patients, I say it's like you go to the gym, you're in shape, everything is good, you have to keep going. You cannot say, so retainers are the same. After orthodontic treatment, everything is good. You still have to go. You should have your retainers. Otherwise, your teeth will shift back.
Right.
But for that patient, our first patient, we had a very good success after. And actually, this patient with traditional braces probably would have taken, again, like about 6 months. But after 2 months, the patient came back to the clinic and I saw her and I told her, actually, you know what? Your treatment is done after 2 months.
Wow.
Yeah, and then...
That's amazing.
Yeah, and she started crying. And I didn't know, actually, that day was her birthday. I didn't know that. And she started crying. She said, this is the best birthday gift that I've had. My teeth look amazing. And it was way faster than I thought. So, and that really gave us a lot of motivation because, starting a new technology is not easy. There's a lot of difficulties in general. Any startup, you think
all the
of
paperwork, everything you have to compliance, and everything that you have to do for a new product like that.
Exactly.
Yeah,
and
it's a lot.
It was not easy, but that first patient really helped us. After we saw the results, we noticed that we are into something big, and then the rest is history.
Aw, I bet that made you feel so good.
Yeah,
that had to just give you so much momentum to move forward with everything.
Of course, I think, because, I have a lot of friends who are like founders of companies and they're like working on their own business or technology. I think the best way to start a startup is that you understand the problem. You completely have the pain. Sometimes I receive an email from a patient and they send a photo to me. They say, I'm taking a photo with my family and this is the first time I'm smiling in a photo.
Aww.
That is very valuable.
Yeah.
Really, it means that we are making an impact. Sometimes we might think it's just cosmetic, but some patients are really insecure about it. For example, like a 12-year-old teenager, a boy or a girl, because a little bit of rotation of the front tooth, they don't smile. They're not confident.
Oh yeah.
Yeah.
I've seen that before in kids, and that's just really sad. Very sad.
Yeah.
And easily fixable, right?
Yeah.
So with Brios, now, does it, after your treatment, are you done? I mean, or do you continue to wear retainers after that, or how does that work?
So it's similar to other orthodontic systems. If we want to say what categories of orthodontic systems we have, orthodontic treatments we have, one of them is traditional braces. The other one is aligners. Right now, we're talking about Brios. I would say this is the third generation of orthodontic systems. With any of these systems, you need to wear retainers. Either you need to wear removable retainers, or you need to have a fixed retainer. So you need to have a retainer. But the orthodontic treatment part of it with Brios, that's a new modality that has opened up a new market. Because maybe if I want to compare it to other technologies, if you want to compare it to braces, it's a great technology. Actually, it has been around for more than 100 years.
Really?
Yeah.
It has?
Yeah.
Oh my
it has
goodness.
been more than 100 years. With traditional braces, you can treat complex cases, but it has a lot of problems. Aesthetics. These days, aesthetics is very, very popular. All the patients want a solution that is aesthetic. And, braces are not really aesthetic. They're very visible,
No.
even if you use
They're getting very creative though these days. But
yeah.
but still.
Yeah, but still.
Yeah. If I were to go the braces route, I would definitely have them like your system on the inside where they weren't visible.
Yeah. So that aesthetic has really changed the industry. Another solution to aesthetics is aligner. So more than 20 years ago, aligners started, and aligner therapy is an aesthetic solution. But it's not 100% invisible. If you go close to the patient, you will see there is something there. There's an aligner. It's visible.
Yes.
It's not truly invisible. But with Brius, it's truly invisible. It's behind the teeth, nobody sees them. The other thing is that sometimes, especially if the case is a little bit complicated, we need to put attachments on the teeth with aligners. They are visible. The other problem with aligner therapy is that we talked about it, compliance of the patient.
Yeah.
If the patient is not compliant and is not wearing the aligners 22 hours out of 24 hours, you're gonna fail.
Which is really hard to do. It's really hard. And I have to confess that I didn't wear them. I did not wear them that many hours, but it still worked. Thank God. In about, I don't know, it was like 4.5, 5 months. But I would, if I would have known about your system before, I probably would have gone that route.
Yeah, sorry about that. But, as you said, even with adults, sometimes we have problem. I had a patient, an adult. She came to me and said, in the last 2 months, 3 months, I didn't wear my aligners because my mom was sick. And what can we do? I said, I cannot do anything. Just I understand your situation, but if you don't wear your aligners, your treatment is not going to be successful. And for teenagers, that's a different story. So, teenagers come back and they have lost their aligners. They don't even know where they are.
Right.
Even adults, they lose their aligners. I have heard this story. We went to a restaurant. I put it in a napkin, and then I forgot. I left. When I came back,
the dog ate it. The car rolled over it.
Exactly. all these things we hear.
Yeah.
But we don't have these problems with Brius. So Brius can. You don't need the compliance of the patient.
Right. Which is huge.
Yeah, actually, even with traditional braces, you need compliance of the patient in the sense that if the patient doesn't come back after 4 weeks, 6 weeks, and you don't adjust the traditional braces for the patient, the treatment is gonna fail.
Right.
But Brius will do the job without any adjustments. Actually, you don't even need to do any adjustments. The doctor doesn't need to do any adjustments. You just place the Brius. It does everything for you. Actually,
set it and forget it.
Exactly.
I love that.
Yeah, exactly. Set it and forget. Sometimes I say, just put it there. When I talk to our orthodontist, let it cook. It does the job for you. I do a lot of lectures, presentations, and I have a series of slides. I call them COVID slides. We placed the Brius for a lot of patients before COVID. And then we couldn't see the patients. Even after we could see the patients were not comfortable to come to the clinic. But it was working. Brius was there. And
still doing its thing.
It was doing its thing, exactly. It's a very complex case.
And how cool when they can finally remove the masks and we can see smiles again. And then they're straight smiles.
Exactly.
That's perfect.
The other good thing about Brius compared to traditional braces, let's say, is that when you have traditional braces, your smile gets better and better, but you really don't see it very well. But with Brius, it's behind the teeth. So even our patients, after a week, they see the movements and they can see the progress of the smile in their mouth. So, and from the very beginning, they have a lot of confidence.
Yeah.
For example, teenagers, especially late teenagers, after they hit puberty, they really care about aesthetics. It's not just adults. Adults really care about aesthetics. They don't want to have traditional braces. But teenagers also care about that.
Oh, yeah, for sure. Once they hit a certain age, it's all about that.
Exactly. They want to go to prom. They don't want to have braces. But, but the problem with aligners is that aligners can treat very simple cases. If the crowding or like spacing or whatever problem the teeth have, if it is more than a certain level, even if the patient is compliant, still you won't be able to treat the patient successfully with aligners. But with Brius, we have proved that we can treat the most complex cases, like whatever you can imagine, canine impaction, orthodontic surgeries, like whatever the most complex cases, extractions.
So from the very simple to the very complex.
Exactly. So it can cover all the different types of, they call it malocclusions. All different types, simple to moderate to difficult, can be treated with. But with aligners, you can do just simple, sometimes moderate, although there is a huge uncertainty about the compliance of the patient. That we don't have that problem with Brias.
Nice. So given your incredible educational background, which is very intimidating to me, by the way.
No,
like,
it's not.
I'm with Dr. Genius here. It's amazing. Knowing what you know now, what advice would you give to yourself as a master student, knowing what you already learned?
I would say, sometimes people might not believe in, something that you're thinking. For example, when I was thinking about Brias, there was a lot of orthodontists that they said it doesn't work. I even remember I drove, when I was in Johns Hopkins, I drove an hour and a half. I went to an orthodontist and I showed the prototype of Brias to that orthodontist. The orthodontist looked at it, said, when I was an orthodontist, probably you were not born. I'm telling you, it's not gonna work.
Oh my goodness.
But I believe that it works, and in these situations, always it's very important we listen to the feedback. We shouldn't be like stubborn about feedbacks.
Right.
We have to listen to others, see what. But if you really think something, you believe in it, you have to keep going, even if others tell you it might not work. Maybe that's the advice that I can give myself.
Absolutely. Well, that's being an entrepreneur, right?
Exactly.
I mean, along the way, when you start, I've started many projects that have failed, but I've had a bunch that have been successful. So that's what we do, right?
That's true.
We've got to believe in the product and put our best foot forward and go for it.
Exactly.
Yeah.
It's very important. Like, this is the entrepreneurship mindset that you never give up. You believe that failure is, maybe these are cliche, but these are the reality. Always we should welcome failure. We should expect failure, but we should also look at the positive things that it might come. Either you win, or it's gonna be a lesson for you. If you look at everything like that,
it's a teaching tool in life, right?
Exactly.
My motto around here is no is just a suggestion.
I love that. I love that.
And my team laughs at me. I'm like, if someone has said no to them, I'm like, oh, they'll think about it, and they're going to come around. But they're just that's a suggestion. So it's kind of funny.
That's very cool. I like it.
Yeah.
Yeah.
Well, I think your product's amazing, and I am so excited to get this message out there and to have you continue to build your company.
Thank you very much, Lisa.
Great job to you. Congratulations.
Thank you. Thank you very much.
Well, that's all we have time for now, but be sure to tune in for part 2 of this Doc Talk Dental. I'd like to thank Dr. Mehdi Peikar for joining us today, and I'd like to thank our sponsor, Brias. For more information on their amazing product, please visit brius.com, brius.com. As always, for everything orthodontic, please go to orthopracticeus.com and subscribe for the latest information. To learn about our other publications, visit medmarkmedia.com. We will see you back here on the next episode of Doc Talk Dental. Until then, be safe and take care, everyone.